Hi, I'm Alicia Sicoli, your compliance expert. Let's review how to remain compliant in medication management. Can you spot the non-compliance in the picture on screen? Take a close look at these syringes. Notice anything off? I'll give you a few seconds to figure it out. All right, time's up. Did you spot it? The syringe in the middle is only labeled with a sticker, but it's missing the additional required elements. To begin, the evidence is clear that medication labeling correlates to improved medication safety. Those little stickers will help our clinical teams avoid errors. National Patient Safety Goal number 3 states to label all medications, medication containers, and other solutions on and off the sterile field in perioperative and other procedural settings, noting that medication containers include syringes, medication cups, and basins. Any drawn medication that the provider sets down on or off the sterile field should be properly labeled. There are 5 required labeling elements: drug, strength, date, time drawn, and the initials of the person who prepared the syringe. Just like everything else in the sterile field, medication labels created in the sterile field should be sterile too. Any syringe drawn or medication basin in the sterile field should be labeled using a sterile label and sterile marker. In most cases, your sterile labels will come in your epidural or spinal kits. If not, label manufacturers offer sterile pre-printed labels as well as single-use sterile pens. Some additional reminders. 1. Any drawn medication that the provider sets down on or off the sterile field should be properly labeled. 2. The person who first opens a vial or fills the syringe should be the same person to create and place the label. No one other than the person preparing the medication should be labeling it. 3. Syringes or medication vials should not be stored in pockets as they can easily be damaged or contaminated. 4. Ensure that the expiration date on any medication vial or supply is always double-checked prior to use. And 5. Be sure to refer to specific hospital policy and procedures for additional guidance. Special note: succinylcholine and rocuronium may be stored at room temperature only for specific periods. Succinylcholine can be stored for 14 days, and rocuronium can be stored for 60 days, unopened or per specific manufacturer instruction. Ensure your vials are properly dated when put into your carts and prior to using. Moving on to scrub the hub. Which hubs have to be scrubbed? The answer is all of them. Every port on the system, injection ports into bags or bottles, injection ports on administration sets, needleless connectors, and the hub of the catheter itself are all potential portals of entry for infection. Be sure to scrub the hub you are accessing every time you access it. It is also a good idea to use alcohol-impregnated port protectors when the line is not in use. The 8 steps to scrubbing the hub are as follows. Perform hand hygiene, don clean or sterile gloves, use a scrubbing device with 70% alcohol to disinfect hubs and ports. When using a pad, make sure not to contaminate it before use and use only on one hub at a time. Prep pads should never be reused. Rub for 10 to 15 seconds unless directed otherwise by manufacturer instruction, generating friction by scrubbing in a twisting motion as if you were juicing an orange. Make sure you are scrubbing the top of the hub as well and not just the sides. Allow the hub to dry and prevent it from touching anything while drying. Access the stopcock or injection port only with sterile devices. Infuse medication or draw blood. Finally, discard gloves and perform hand hygiene. To wrap up this educational module, on screen is the ASA standards list for color-coding medication labels for your reference. Thanks for watching. Check out the description section for my contact information and clickable links to references and resources. If you enjoyed this segment, don't forget to like, comment, and subscribe for more content. See you next time.